Good afternoon, Mendocino County, and welcome to our Friday update on September 4th. We're here with CEO Carmel Angelo, our Health Officer, Dr. Andy Coren, our Department Operations Center Manager, Becky Emery, and we're going to start with a county update with CEO Angelo, and then we'll move over to Health Officer Coren. Carmel, take it away.
Thank you, Sarah, and good afternoon, everyone. Yes, this is our weekly COVID update. We are very appreciative of all of the media that shares this with us and gives us the opportunity to update them and update the public. So thank you. This is the beginning of another holiday weekend. Dr. Coren will speak about this, but I would just like to say that for everyone out there, please be cautious as you move forward with this holiday weekend. It's not unusual during holiday weekends that we meet with our friends and family. And so, as I said, Dr. Coren will speak to this. I would just also like to say that please proceed with caution as we move forward over the next few days. One of the areas that Mendocino County government has been struggling with, as the public is aware, has to do with the monitoring from the state. And as you know, the state now has developed a 4-tiered system. We are in the highest tier. I believe it's called the highest tier, but it is the purple tier, which basically says that our numbers are off the charts. Dr. Coren has been reviewing this and will continue to do so. And Dr. Duhan has been analyzing the data as she has over the past 8 months. What we know coming from a rural community is that not all urban, suburban, and rural counties are the same. And our struggle is like every other small rural community out there, getting the state to understand what a rural community is and what it means to experience a COVID pandemic in a rural community, and that it is different than urban and suburban. And of course, if you're watching our Board of Supervisor meetings, you know that our Board of Supervisors is very concerned about this and has been advocating at the state level and continues to do so for the state to look at rural counties with unique circumstances. I would like to say that Dr. Carrie Brown has been, Dr. Andy Coren, Supervisor Carrie Brown has been successful with her colleagues at KZYX in getting the state to understand that there is a different perspective with rural counties. And so the state has scheduled a meeting with rural supervisors and CAOs to discuss the COVID pandemic in rural communities and what that means regarding the attestation, regarding the 4 tiers, regarding how we proceed with this pandemic. So I think this is good news. We don't have any decisions from the state yet that will say that rural counties are unique and that there may be some differences with rural counties as compared to urban and suburban, but we have the first step. And again, I would like to say Supervisor Carrie Brown and her rural county colleagues have been successful in getting the state to agree to meet with them to discuss issues that are unique to rural communities. So stay tuned to that because there will be more information coming, and we hope that it will be good information. So with that, I would like to turn this over to Dr. Andy Coren, who is our new health officer. I believe most of you know Dr. Coren. He's been in this community for decades, and he is well-established, well-known, and is a wonderful person, along with being a good doctor, and someone who I think can really assume the health officer role and do a great job in protecting us. Dr. Coren?
Okay. Thank you, Carmel. Do we switch over to me? I'm not quite sure. Sarah, am I on?
You're up.
Oh, okay. All right then. So thank you, Carmel. I will try and do my best as we go forward. So the health officer report is as followed. We know that this is a Labor Day weekend, and we are looking forward to some rest and relaxation, but there are some warnings. Now, first, I wanted to just get back to the fact that there have been fires. Some are coming over the hill, or they're not coming over the hill, but they're coming from the east, and we certainly are smelling them First, before I get into anything more, I want to acknowledge that a young woman firefighter gave her life this week to protecting us, and we honor her and mourn for her. But we should also prepare for ourselves, and there's preparation for evacuation if it should come to that. Make sure that you've got 5 days of medicines ready, 2 days of clothes, some small amounts of personal belongings that you would want to take and ready to go if you're called on for an evacuation. There is also smoke. We've gotten over some of the threat of some of the fires, but the smoke still lingers, and it's very bad for the lungs and actually very dangerous for people with heart disease and lung disease. And being indoors is better than outdoors. Air condition is better to recycle rather than full-on air conditioning, which may make you a little cooler, but brings in the very smoky and poisoned air. So try and recycle that air that you have in the house. The heat is also going to be terrible this weekend, and it's predicted to be 105 to 110 degrees. Again, it's safer to be indoors than outdoors in that heat. Drink lots. Avoid heavy exertion, either at work or at play. It also brings on big threats of more fires, but also power shutdowns. So we want to avoid heavy air conditioner use. This is also a time this weekend for traditional parties and barbecues and gatherings. Please remember that a household is 6 people. More is very risky. Inviting and having your celebrations with more than 6, with extended family, with visitors, each of those things will be more and more risk. Being outside reduces the risk, so you're able to stay 6 feet and more apart. Wearing masks is also a good way to protect yourself and protect your friends and family from any germs that you may unknowingly be carrying. Avoid congested areas. Now, these are a little bit contradictory. What do? Stay inside for the fires and smoke and protect ourselves from that, or go outside to protect ourselves from COVID? It's not an easy thing. Try and reduce the harm. Use your judgment. If the fires and the smoke is terrible, stay inside more. Maintain your distance, use your masks, wash your hands a lot. So having said that, I want to move on to the actual COVID numbers and the update. And I want to say, we've been doing pretty good. I'm going to switch to a graph here if I've got the technical ability to do that. Let's see, it's share screen first. Let me find that. There we go. All right, let's see if I can bring this off. These are our new trackers. Here we go. And so let me just say that our numbers have been falling. Actually, I think we may have a graph that shows our epi data. I can't get to it right now. It very nicely shows that we've actually been doing quite better in the last week or so. And so we have less cases, less hospitalizations. I'm seeing more people on the street wearing their masks. The businesses are helping us out here with making sure that people are staying safe within their establishments. And not only have we decreased our case rate, but the state has also had less cases, less hospitalization, and a lower rate of deaths. So for that reason, new guidance has been coming. We want to not make the mistakes of the past. In March, where everything was shut down, we had to because we did not have information, and it seemed like a huge wave coming. But then in May, we opened up a little bit, and we had more of a bump of our illness and fatalities. So we're going slowly in opening. And the first things that have been done, you may already notice this, is barbershops and hair salons, groceries, retail, and even malls are lifting some of the restrictions. There's changes in the cohort groups for childcare and children's extracurricular activities. The numbers have gone from 12 to 14 allowed with 2 adults. You don't want to be in multiple of those cohorts, but a family of 6 can be safely together. And in fact, we don't recommend necessarily using masks or social distancing in that household unit. However, the other units, we would like people to continue to wear masks and maintain social distancing. It's not completely safe. The tiers have been replaced by a the tiers have replaced a one-size-fits-all monitoring list. And so it allows us a little bit more flexibility to open slowly within the sectors or within the tiers, and also to allow us to open in a more controlled way between the tiers. So the tiers are in the order of 1 is widespread, and the color that's accepted is purple. We are in that tier. This means that non-essential indoor business operations are mostly closed. The second tier is substantial burden in the community of this illness, and the color is red. It's no longer widespread, but substantial. And we have numbers for each of these, so I'll go over that in a minute. But what that means is non-essential indoor businesses are starting to open. In tier 3, it'll be called moderate, and it is the color orange. There are more indoor businesses will be open with modifications. And finally, yellow, minimal. Most indoor businesses we would like to have open, but with modifications. So the calculation has also changed. We used to be average cases per 100,000 over a 14-day period. We've changed to a more accurate calculation, which looks at a 7-day average of a 7-day average per 100,000 population, but with a 7-day lag. So we don't look at the last 7 days. We look back a week, and the week before that is the one that we calculate the 7-day average for. Mendocino stats are as follows. Our total count. Oh, you can see it on our new display. The total cases are 724. In isolation, there are 61 at this time. Current hospitalized, I'm going to use my pointer here, are 3. There are in the ICU 2 people at this time at our last call. One of those has been very long on a respirator in San Francisco, but we do have a new one this week in the intensive care unit. And we've held steady at 17 people who've passed away from our community. In quarantine at this time, there are 126 people, and that's actually down from what it was the last time we looked. So for us, the average daily rate, again, 7 days ago, the average daily rate is 9.57. And what we'd like to be to get out of the purple zone is 7. And I was going to try and show you this on a graph, but our epidemiologic data does show that in the last week, we are having less and less positive tests. However, the weekend is coming up, and actually the first judgment is not going to be done until Tuesday, and then we'll actually know what the state sees. And I can say that the case fatality rate is something we look at very carefully, and in our county, it's 2.35% of people who get COVID are succumbing to it. And that is a little higher than some of the other counties around us, but significantly lower than the larger, more heavily populated areas to the south of us. So we are opened for outdoor food service, wineries and tasting rooms if they sell their alcoholic beverages with food. Booze alone is still prohibited. Movies, family entertainment, zoos, museums, fitness centers, places of worship and cultural ceremonies, and are still opening up a little bit. Nail salons and tattoos can open outside, and we are actually revising some orders come next week after having met with the leaders of our lodging industry, and that will be released on Tuesday, not before, because we really want to preserve our advantage on this disease over the holiday weekend. There is another measure that we're using in the state, And this is going to improve our ratings, and there's more good news to come. The first test that's going to be adjusting our 9.57 is a test positivity rate, and that is here. So our test positivity rate now is 3.05. So 3.05%. So of 100 tests, 3 of them at this point are turning out to be positive. Now, as we do more tests, we may uncover some more tests or some more positives. But as we do more tests, it gives us more information. So we don't want to be penalized by the increase in numbers that we uncover. But as our percentage of positive tests goes down, we get a reduction in the daily positive cases, and it goes in our favor. So the upshot of that is get more tests. We're lately been falling back on the testing in the community for people who do not have symptoms. We're just doing it for surveillance to see how much is being affected in our community. And the good news is that the results are coming back from OptumServe and some other labs within 3 days, whereas a couple of weeks ago it was a week, sometimes 2 weeks before people would get their results. It is now pretty consistently 3 days. The other thing is that the contract we have with OptumServe provides free tests at the fairground in Ukiah, Tuesdays through Saturdays at 7 a.m. to 7 p.m. And you can make an appointment online by going to ihi.care/COVID testing, or you can call 888-634-1123. Please test more. This is giving us all more information. And as we do find positives, we can go out and talk to them about being isolated and their contacts about quarantining to really contain it so it doesn't run rampant through our community. Now, in addition to this adjustment, more is going to be coming, called an equity adjustment. That has not been decided yet. It may involve things like the fact that we are rural, and there's the conference that CEO Angelo has reviewed. The California Department of Public Health is very interested in figuring out how can we adjust this so that we're not penalized. Other things that would be looked at for adjustment are percentage or maybe percentage of race, poverty level, and those kinds of social determinants. So how quickly can our state move through this, purple, red, orange, yellow tier structure? Well, they look at us every 3 weeks. We can't move faster than one tier in 3 weeks. So that November 2nd, if we pass through the tiers really consistently, November 2nd would be the earliest we would enter into the yellow tier. If, on the other hand, we get to, let's say, orange and we're doing not so good, they'll move us back to red or to purple. So we want to make this Labor Day quiet because this is the time when relaxing our restrictions, we could have a real bump in the numbers and a big problem. Whereas at this point, if we look at our epidemiologic data, it really looks like in the last week we're doing pretty good. And if we can keep it down low, then we'll probably get into the red zone soon. And our first evaluation will be next week. It'll be September 8th, is what I understand. And they'll be looking back at August 23rd to August 29th. So that's how this works. I want to say something else about the data. You'll notice that Ukiah is, of course, the most heavily affected. We're the most populous in that area. And that, interestingly, and we've known this for a while, the most affected age group is, interestingly, 19 to 49. These are the people we think are the strongest and so on and so forth. But they could pass the contagion much more to the folks who are more vulnerable in the community. And so we worry about them. The other group that is disproportionately affected is our Hispanic community. And we're trying to look at that very carefully. It is very clear that it's because they provide the essential work in agriculture, in food preparation, cleaning, and personal care at home and in hospitals and in nursing homes. They are traditionally underpaid and can't afford to take a day off even if they feel slightly ill. And so COVID has really laid bare that disparity in Mendocino and in the whole United States. Mendocino has been partnering with Latinx community partners, and we've also formed a task force to help us at first with translation of documents and producing documents and videos that are in Spanish, and they've done a good job at doing that, but it's not enough. We need more than language. We realized we had a meeting just this past week with our task force and with the Latin community, and we need a deeper understanding of the Hispanic culture that we don't appreciate, and so we can't necessarily influence and help them to understand what the dangers are. So this is problem solving that we need to be doing, and one of the things that it speaks to is that we depend so much on Hispanic volunteers, and that doesn't give us the appropriate insights as we're forming our procedures and understanding what's going on. And so we want to increase hiring through grants, and then also bringing up people who are going to be more skilled and understand the county workings, and eventually provide a significant amount more leadership for us in the Department of Public Health and in the county. So I want to say in closing, this weekend, let's have fun, let's relax, but let's be very cool. Let's try and use the distancing, masks, hand washing, and safety to keep our infection lower. So be cool and stay cool. And that's the end of my report.
Thank you, Dr. Coren. Can you exit share screen mode, please?
Oh, I sure will. Let me do this. Let me see. Exit share screen. Do it that way. No. I'm going to close this down.
It should be at the top of your screen.
There it is. Okay. Yeah. Okay. Good.
Perfect.
Thank you.
So now we're going to move on to our questions section of today's update. We'll start with our media outlets. Then we'll go to our viewers. Leave your comments below. We'll try to get to as many as we can. So with that, I'm going to start with KZYX questions, and they sent that via email. So the first question from Matt Lefevre is, Mendocino County's death rate is higher than the surrounding counties. The number of deaths divided by the number of cases. Can you speak to why? What does this say about the nature of care provided in the county?
Matt, that's a good question, and it's something that we are aware of. And it is something that I honestly don't have a good answer for, but it's something that we're looking into. I don't know whether it's that people get into the hospitals and they're sicker, or they have more vulnerability, or there is an issue with how we're treating people who are sick and in the hospital. So I can't give you a good answer for it.
Our next question for Matt is, this week behavioral health presented some startling statistics regarding the increase in suicides in the county in the wake of this pandemic. What do you want to say to a public that sometimes pits pandemic mitigation protocols against the mental health reality our community is facing?
Another great question, Matt. I do have some personal experience in that. I did have contact with a woman who in her family lost a relative, and it's devastating to lose people. And I myself remember back my father, who lost his father to suicide during the Depression. It wasn't the same kind of a thing, but clearly our decreasing the economic activity is having huge effects on the community. They're losing their jobs, losing income, are having trouble getting food. It goes on and on. It's a reality. And it hit me when I listened to Dr. Miller's presentation as well. It is something that I plan to meet with her about this week. And I think we all need to take note of that. We certainly don't want to lose more people in the community. We don't want anybody to lose more people in the community, but we need to acknowledge the hardship that people are going through. In other countries, there is much more financial support for families who are being quarantined or isolated to protect the community. And we are running out of even unemployment insurance that was extended earlier in the summer. And I think this is a great tragedy. So I think that we need to pay attention to it. It's people who are quarantining or isolating or have lost their jobs are making a huge sacrifice, and we need to, understand it and improve our response to it.
Dr. Coren, this is Carmel. I would also like to remind the public that mental health does have a warm line, which is a non-crisis call line for help. You could call if you want to just talk with someone, or if you have a question, if you have a need. And again, that's our behavioral health warm line. And that number is 707-472-2311.
Thank you.
Thank you, Carmel. Next up, we'll move over to KZYX. Sarah Wright.
Hi, can you hear me?
Yes.
Hey, thanks for doing this today. Yesterday, we got a press release from the county saying that we'd experienced a case spike from social gatherings and apartment settings right before the weekend. But we just heard that we're doing pretty well. So I'm wondering if you could explain the spike and the ramifications of that.
We always have a spike with holidays, and we have slowly been decreasing our numbers, and I think that that'll be beneficial, but I think we need to make sure everybody understands that the Labor Day weekend is a very high-risk weekend for increasing our numbers or getting into a problem with a spike.
So we're expecting a spike, but we haven't had it?
Yes.
Okay. And I want to thank Becky Emery for sharing the numbers this week of people in various professions who have come down with the virus. And I'm wondering if there's more information from the contact tracing that can be shared, like how many of the people who work in retail or ag or, whichever sector got it while they were working, or if that's a situation of people who have low-wage jobs then going home to these crowded conditions that we've heard are so dangerous.
Hi, Sarah. Thank you for that question. One of the things that I think was one of the big impetus behind the press release that was issued earlier was also that not only are we seeing, are we worried about what's coming with this weekend, but we are seeing more and more cases that are spread in family gatherings and in social gatherings versus those individuals that get it from a coworker at work. And so we really appreciate the work that people are doing in their businesses. We want to ensure that that continues, especially around break rooms and making sure that people are wearing their masks. And so that's really part of the other part of that press release, and also the work that we're doing. As far as the actual numbers on where everyone is getting or where our case investigation is identifying as sources, I don't have that information, but I do hear that request, and we'll see what we can put together.
So it sounds like the measures that are being taken in workplaces are being effective, and the cases are starting to show up in more personal settings.
That's correct.
Okay. Thank you so much.
Thank you, Sarah. Next up, we'll move over to Mike Adair with Willits Weekly. And Mike, you're muted.
All right, can you hear me okay?
Yes.
All right. Yeah, I got two questions. I've noticed in the statistics that there are quite a few more women who are testing positive than men. I would ask Dr. Coren why. Do we know why that is?
Well, I don't think we know absolutely why, except that a lot more women because they are in these essential jobs, are having to go to work, and they're working in, some in very close quarters, and they are getting it in the community, whereas the men are perhaps more in separate work and other kinds of areas, and they're not as exposed. But it's not clear to me. Becky, do you have any other insights into that?
I know that we have identified that spike or increase that we're seeing in the women, but we haven't been able to yet identify the source, but it is something that we are looking at as well in our demographics and the data that we're evaluating.
Thank you. Okay, my second question, this is for Dr. Coren. At the Board of Supervisors meeting on Tuesday, you were asked to kind of sign on to a board initiative, as it were, to get more control over how the county is dealing with COVID-19. And you, Dr. Coren, you kind of said that you didn't think that was a good idea. That's a paraphrase. Then later on in the day, actually right almost at the very end of the day, they formed a little ad hoc committee of Supervisor Williams and Haschek. And the purpose of this was to work with you to draft a letter and to get all three of you, the Board of Supervisors and you as the public health officer, to sign that letter. Can you tell me what's happening on that? Has that been derailed or stalled, or are you going to go forward with that? Thank you.
I have not been called to a meeting like that. It may be moving forward. I don't know what's come of that. So, at this point, I am happy to take the lead with the state as we learn more about it. But I think that there are some differences between a larger community and a smaller community. And I would like to talk about it more with the supervisors.
Okay, great.
Dr. Coren, this is Carmel. I do want to add that Supervisor John Haschek and Supervisor Ted Williams are the ad hoc. And what they said, Mike, was that they did not want to move forward unless they moved forward in consultation with Dr. Coren, and that Dr. Coren supported their actions. So there was a meeting, there will be another meeting, and then the goal is that there would be a collaborative effort between the board, given the ad hoc, and Dr. Coren. And I would also like to say that Supervisor Williams made it very clear in the board meeting that he fully supports Dr. Coren. So the goal is not to write a letter to the state that would not be in support of the health officer and his role and with the health officer, but to work collaboratively with this.
Thank you, Mike. We'll move over to Susan with the Independent Coast Observer.
Thank you. Contrary to what I've heard today and the press release about the spike in cases, it does not seem to me that the numbers are going down. In fact, every week they increase by approximately 10 or more cases. I have seen no diminution in the number of cases. So I was curious why. I heard this at the Board of Supervisors too, that people were cautiously optimistic about the numbers going down. I have not seen that. So I'm curious Are you looking at different numbers than I am? I'm looking at that dashboard every day.
Yeah, and I appreciate that, and I'm glad you're keeping an eye on it. But an individual day or a couple of days here and there is very hard to judge, which is why we have these very complex formulas that they've come up with to look at it. Let me see if I can share this screen to show you what I'm looking at. And I don't want to paint too rosy a picture, but I want people to understand that there are times when it really spikes and it could happen again. Let me see how I can share this. Put it back down here, share screen. Okay. And I think we're here. Let me see if I can make this larger. There we go. Can you see my screen at this point?
Yes.
So we had this large spike, and it's been coming down very, very gradually. This is a visual representation, and this is not, huge, but it does show that there's some decrease at this point. Now, next week it could go right back up, but I want to give people an idea that what we're doing is having a beneficial effect. Let's keep doing it. And the danger is this weekend. So if we keep going in this direction, I want to be hopeful, but we could, graduate to a red tier in another 3 weeks. We're not going to do it this time, but given 3 weeks, if we can continue that downward trend, and you can see it visually better than you can, see it by looking at day-to-day numbers. Because yes, day-to-day numbers changes, and it changes for a number of reasons. It changes because we don't always have all the data from our testing in at the time that we publish. So what we're trying to go to now with our current 7-day average, 7-day lag, this lag will account for unreported results and allow us to get more of an average. And if you just try and do things on a day at a time, we know that it doesn't tell us as much as it does as if we look at some averages. Does that begin to answer your question?
Well, I'm basically looking at it. I look at it more than once a week, but the day I'm concerned with is Wednesday because we go to press Thursday morning. So it has not diminished at all, either the number of deaths or the number of cases. To plot a graph of Wednesdays for the last, 2 months or so, it has not decreased. So that's why I was puzzled, but I see your graphic that you have looks a lot more sensitive. So it's showing more fluctuation.
But there is the day-to-day fluctuation. Clearly, our death rate has not increased at this point, and our number of deaths has not increased for some time. And then again, looking at the numbers can be very deceptive day-to-day or even week-to-week. That's where these complex calculations are recommended. I'm going to stop the sharing so we can get back. Does that help answer? I mean, the science of doing this is why we use science. I could be wrong. We could be going up, not down. But when you look at it overall, there's value to looking at the gestalt. But there is not value in depending on that, because then we'd be very Pollyannish, and we don't want to do that. So we want you to have the information at your fingertips, but there is a more accurate way to depict it using these calculations.
And Dr. Coren, if I may add, because I know that my statement was that our case averages are going down. So the overall case numbers, of course, are not going to go down because we're tracking those throughout the event, and they will consistently go up as we have more cases. However, our daily average number of cases of people that have tested positive that day has been decreasing. And so when I said that we are cautiously optimistic. We, if you'll recall, 2 weeks ago, we were averaging 16 cases a day. And so when we talk about what we're averaging in our case averages and our numbers going down, we're talking about the positive cases that day received. So I hope that helps as well.
Thank you, Becky.
Like another person who asked about the discrepancy between men and women, I was very interested in Becky's numbers about the different professional sectors that people are testing positive, that they participate in. And it appeared that most of these sectors that have more women in them working were things like retail and lodging, food service, those kinds of things. And I'm wondering if the county gets more opened up to more people able to work and serve food and serve retail customers, is there fear that that will cause this to turn around and become much more prevalent again?
Yes, that's why we have these calculations that are drawn out. And that's why we're doing it slowly. So where before it was either you're on the list or you're not on the list, that didn't work so well either. So now we have a much more complex way to try and get back. But as you know, the social consequences of being locked down are huge. And as we think we're getting it more under control, we do want to open up slowly but surely. And the way to see what the effect is unfortunately not simple, and it takes time. And everybody's anxious to open up, tomorrow, next week, whatever it is, and we have to hold back.
Thank you, Susan. We'll move over to Mendo Voice. Adrian Bowman. And you're muted, Adrian.
Yeah, no, I was fumbling with the mute button. Thank you, Sarah. Thank you, Dr. Coren. Thank you, CO Angelo. I just wanted to start off, Dr. Coren. You mentioned in your report that there was some loosening of the restrictions on houses of worship, other social gatherings. You said that there was some loosening happening, but you then didn't specify what that was. Is that prospective loosening? Is that loosening that's already happening? Is that in an upcoming? Is that a function of the new tier system? Can you elaborate on that, please?
Well, when the state went to the new tier system, barbershops and hair salons were able to open, still outside. Groceries were a little more relaxed in small retail shops. Malls were allowed to open for the first time. We don't have many malls in Mendocino County. But again, while they were able to open, the community or the common areas and eating areas were restricted. So it tells me that there is a gradual reopening as a response of coming out of the peaks that we're seeing over the summer after the July 4th holiday. The other thing that has happened is we've gone to slightly larger groups of childcare and children extracurricular activities. And that is something that we think will bear some fruit in terms of relaxing some of the problems that our restrictions and close down have caused within families. So yeah, there has been some opening up, small, and it continues to be small as we stay in the purple zone, and it's not going to achieve great rates, but I think we'll feel a little bit better slowly but surely. And then next week I am releasing some orders that will relax some of this more. I'm sorry. Go ahead, Adrian.
Just to clarify, I just want to be very clear about this. When you say we, you mean we as a state. You don't mean that your office has made a change. You mean that the state government has loosened some regulations, and that
That's
we as
correct.
a state. Okay.
That's correct.
Thank you for that. And I'm sorry, I interrupted you. You were about to elaborate on the changes that are coming down the line next week from your office.
Right. Well, I don't want to elaborate on them. I just want to say that there are some coming down, and they have to do with the lodging industry. But we don't want to relax anything before this Labor Day weekend.
Okay, great. If I could also just sort of clarify, I was a little bit confused with your answer to Sarah's question about the spike press release. That was saying that you, if I understand it correctly, that was saying that you've seen private gatherings be a vector, and that you're concerned for this weekend. That wasn't saying that spike had been happening in the past. Is that correct?
The spike around gatherings is something that we know happens. That's, it's community spread, but then the biggest thing here, if you look on the chart, is close contacts, and that is usually gatherings in our county, and so we're very worried about that. And when we see a number of positive cases, we often track it back to gatherings. So those are some of the most important vector. And then the next most important is under investigation. We don't quite know.
Okay, so you just again to understand that clearly, you're clarifying these sources in that press release, in that comment, and warning us about the possibility of that spread this weekend. You weren't saying that there was a new distinct spike that had occurred, because when I read that press release came out 20 minutes or something before the new numbers for yesterday, and I read that thinking, oh, there's going to be a ton of new cases today, but then it was a relatively small number yesterday, and so I think we were a little confused about that, the timing of that. So am I getting that right?
Yeah. So we're seeing. Let's put it this way, and it's confusing. I don't want to say it's not. We're seeing more days with smaller numbers of new cases. It's not dramatic and it's not sustained. But because of some of the decreases or we should say increases of good days, we're trying to relax the restrictions. But could we have a general community-wide spike or a number of festivals and gatherings and stuff like that could cause a spike that affects the entire community negatively? You betcha.
Okay. Thanks for those clarifications. And just so I wanted to give you an opportunity also to talk about, if you could talk a little bit more about the interaction of the air quality, the smoke, and COVID. I'm sitting here, I'm actually parked in my car, and I'm watching a giant cloud of smoke, a pyrocumulus, come up from the August complex in the National Forest. So, what has research told us about how smoke and COVID might interact?
I covered this actually last week, and the research that I had read shows that there is a positive association of more smoke, more large particles, and the mortality rate in a community goes up significantly. So the smoke is an exacerbating factor. Does that answer your question?
Adrian, you're muted.
Nope.
That is weird. I don't know how I got muted. Thanks for that, Doctor. I was that's embarrassing. I was saying aha and commenting the whole time. I wonder if you heard me.
No, I don't think I did.
I was saying thanks for elaborating on that. I just wanted to touch on it again because I know you covered it last week, but people don't always tune in for every one of these consistently every week. So sometimes somebody who saw it, who wasn't listening last week, might be listening this week and get to hear that information.
Good. Well, thank you for that. And let me just point out also that the atmospheric, the general conditions are very contradictory. What do? It's hot. You want to be on air conditioning. If you put it on air conditioning, you're going to pull the smoke in. So, the air quality people have said, go inside, put on the fans, and try and avoid the air conditioning. Well, if it's hugely hot, you can't avoid them completely, but you can, like in my house, I have air conditioning, thankfully. And instead of keeping it in the range of 70, and sometimes it goes down to 68, we've increased it to 76, 78. And that sucks less energy from our power grid and perhaps less power shutoffs. Being inside is not so good when you're looking at COVID transmission. Being outside is not so good for the smoke and the heat. So we're balancing. The main thing to remember for COVID is, try and not have large gatherings. If you're going to get together with just the household. If you're going to get together with other people, keep it to a minimum. Use your masks, keep your distance, wash your hands. Don't throw all the recommendations out the window, but they are contradictory, and it's difficult to figure out what's best. And it may come down to individuals figuring out what's best. That's why I want to give the information out so everybody can reduce the harm that they expose themselves and their family and their loved ones to.
Thank you very much, Doctor. Hopefully I'm not muted right now. Thank you.
Thank you, Adrian. So we just have a few more minutes here today. So I see a couple questions in the comments. We'll try to take a few of those before we leave for today. The first one I see is, why is ethnicity on the dashboard? It would be nice if ethnicity was removed from the dashboard. So can you talk to the reasons why we include that data?
We look at a lot of data in order to understand what's happening and how to avoid, how to decrease the illness in our community. So the ethnicity data shows us an incredible disparity with the Hispanic community leading the way in this unfortunate epidemic, and so we deduce from that why. And those are some of those reasons have to do with disparity in the workplace, long-time discrimination in terms of hiring, lower wages, closer working conditions, people in such poverty in the Hispanic community that they can't afford to take a sick day off of work when they're sick. And so they may be spreading this a little bit more. Those are some of the reasons we think are going on. But to not look at the ethnicity data would be to cut the legs out from under us in terms of understanding what is happening in our community. It's not that that we want to be discriminatory against the Hispanic community, but we want to actually, and I think we're trying to do that, collaborate with the Latino community to figure out what can we do, what can they do, how do we get this under better control. So I think that's the reason for us having ethnicity data here.
The next question we have is, can Dr. Coren please explain the difference between isolation and quarantine? Is there really a significant enough difference to warrant using two separate terms for avoiding contact with others?
That's a great question. So we isolate people, and it's more difficult to be under isolation, but we isolate them for 10 days after their test has been shown to be positive, because in that 10 days, their infectivity, their ability to transmit the disease decreases so that by the 10th day, they can join the rest of the community. Quarantine is applied to those people who've been in contact with someone who we know has the disease. And we don't know if they've caught it or if they've not caught it. We don't know exactly when they might become symptomatic or if they're going to become symptomatic. But if they've caught it, then any time during the 14 days that they've come in, since they've come in contact, they can be contagious. And so quarantine goes on for a little bit longer, actually, than isolation. And that's because the people who have the disease, they're killing it, and they get more immune and they don't transmit it as much. Whereas the people who are in contact, we don't know if they're going to get it or get symptomatic. They may be pre-symptomatic or they may be asymptomatic the entire time. But those people may be passing on, transmitting the disease for a longer period of time. And that's the difference between those two names.
Okay, so we're at 3:01, so that concludes our Friday update for today. I just want to quickly mention we did get some comments about this new tier system. So we put a link in the comments covid.ca, covid19.ca.gov. You can check out the charts from the state talking about the tiered system, as well as a map to check out the demographics and the numbers for the different states. So if you want more information, you can go there. There's also a link to it on our webpage. We will see you again next week. Thank you for joining us. Thank you, Dr. Coren, CEO Carmel Angelo, and Becky Emery. Until next time, have a wonderful and have a safe holiday weekend.
Thank you.
Thank you.